Hi everyone, and welcome to my YouTube channel. My name is Dr. Tolu, and in this video we are going to be answering this question: what causes painful sex in women? So if you like what I have to say, hit the subscribe button, hit the like button, and leave a comment for me letting me know if you found this video useful. And if there's anything you would like me to discuss or any health topic you would like me to discuss in the nearest future, also leave it as a comment. If you have any constructive criticism for me, also leave it as a comment. Alright guys, so let's get straight to it. So the big question is, what causes painful sex in women? First of all, we need to understand that painful sex can happen in both men and women, but for the purpose of this video, and also because it appears to be more common in women, we are going to be exploring the causes in women. So painful sex, or what doctors call dyspareunia, is when during sex, maybe during penetration or even maybe shortly after sex, the woman experiences pain. Now, the pain may vary in intensity. For some, it may be some degree of discomfort. For some, it's pain that may be there for even days after they've had the sexual encounter. There are a variety of possible causes, ranging from medical conditions to even psychological problems. But what I'm going to do in this video is to talk about the common ones as we see them in women. When we explore pain on entry, that is during penetrative vaginal sex, entry of the penis into the vagina, one of the most common causes of this is poor lubrication. With regard to lubrication, I'm talking about lubrication of the vagina. And the usual culprit is when there is little to no foreplay. Foreplay is really important, especially for those who want to enjoy sex. And foreplay appears to be even more important in women. This is because it usually takes more time to get their bodies ready for sex. Also, pain on entry or penetration is also linked to conditions that are associated with a reduction in estrogen levels. When we look at conditions like menopause, or for women who have given birth and are breastfeeding, or even childbirth itself, these are conditions that are linked with a drop in estrogen, and this drop in estrogen is linked with vaginal dryness, which can then make sex more painful. Some medications can also lead to pain upon entry. Medications like some antidepressants, antihistamines, or even birth control pills. Then another common cause of pain on entry is a condition called vaginismus. Vaginismus is an automatic body reaction to the fear of some or all forms of vaginal penetration. So that's just a lot of medical jargon to say that when there is about to be vaginal penetration, especially during sex, the fear of that happening, whether due to whatever it is that may be responsible for the vaginismus, may then make the vagina less accommodating for the penis, and then that can lead to discomfort. Also, any inflammation or infection associated with the female reproductive tract, or even the female urinary tract, or even an inflammation of the skin around that area, like eczema around that area, all of these things can also lead to pain on entry. And the last possible common cause of pain on penetration is anything that's caused some kind of injury or trauma to the female reproductive tract. So when we look at conditions like female genital mutilation, pelvic surgeries, or even episiotomies, an episiotomy that has been done maybe poorly or has healed poorly can be responsible for pain upon entry. An episiotomy, just for those who may not know, is that cut that is given during process of childbirth to make the birth canal larger than it is, so that it will enable ease of passage of the baby from the womb into the world. Also, some women experience pain on deep penetration during sex. Many times, this kind of pain can be associated with the sex position that is assumed by maybe the woman and her partner during sex. There are some sex positions that increase the risk of experiencing pain during sex, and it's very important for the woman and her partner to have conversations around this. Sex positions that allow for deeper penetration might cause pain in some women, but of course definitely not in all women, but for some. And it's important for her to have conversations with her partner about this sort of positions. One position that we've come to realize can help to reduce the risk of experiencing pain during sex is positions where the woman is on top and in control of the depth of penetration tend to reduce the risk of experiencing pain during sex. Also, some medical conditions can increase the risk of experiencing pain upon deep penetration during sex. Medical conditions like endometriosis, adenomyosis, uterine fibroids, hemorrhoids, pelvic inflammatory disease, ovarian cysts. These are some conditions that can increase the risk of experiencing pain during sex. Women who are experiencing some form of medical treatment or maybe have experienced some kind of surgery might also be at increased risk. For instance, those who are undergoing some form of chemotherapy or radiation treatment for treating cancer, or women who maybe have had a hysterectomy done might be at increased risk of experiencing pain during sex. And lastly, I'm also going to touch on psychological factors. It's very important to note that many times for women who experience pain during sex, they may water down the effects that psychological factors can have on them. But it's very important to point out that psychological factors also play a big role when talking about pain during sex. For instance, for women who maybe have experienced some form of sexual abuse or maybe even any form of abuse in the past might be more susceptible to experiencing pain during sex. For women who maybe struggle with anxiety, depression, or mental health conditions of the sort, that could also increase their risk. Also, there are women who have, maybe due to previous multiple heartbreaks, who may have fear of relationships or fear of intimacy during relationships. This can also increase the risk. Even something that may be overlooked, something like stress, can also increase the risk of women experiencing pain during sex. This is because stress is sometimes associated with the tightening of the pelvic floor muscles, and this tightening can then cause more discomfort during sex. Now that we've explored some of the common causes of painful sex, it's important to also touch on what women should do when they experience painful sex. So, in a woman's lifetime, at some point or the other, it might not be out of place for her to experience some degree of discomfort or pain during sex. However, if this has been noticed to be recurrent or happening often, it's important to get checked by your healthcare provider. Your healthcare provider is most likely going to ask you questions related to your medical history to try to see if there's anything in your medical or surgical history. Some of the things I've touched on, like maybe fibroids, endometriosis, adenomyosis, previous pelvic surgeries. Try to find out if any of those things are present in your medical history or maybe your gynecological history. Then some of the questions may also be around maybe the medication you are on, just questions around taking a clinical history to try to find out if there's anything that may give them an inkling as to what's causing the pain. Your healthcare provider will also want to examine you, do a physical examination, maybe even a pelvic exam or an abdominal exam, depending on what he or she is suspecting. And they may also ask you to run a couple of tests, maybe like blood tests like hormone profile to see if there's maybe like a drop in your hormone levels like estrogen. They may also want to do maybe some scans, depending. There are so many things that they could decide to do, but it usually depends on the information that they're able to get from you and also what they suspect to be going on with you. So I would like to end this video by saying that pain during sex happens more commonly than you think, and in many cases there is a treatable cause. So it's important not to suffer alone, or maybe not to think that, oh, sex is, you are not one of those people who is supposed to enjoy sex. That's not true. If you experience painful sex, please see your healthcare provider, and there's a very good chance that they'll be able to find out what's going on, offer treatment, and then that can help you to enjoy sex even more.
Keep me closer.
Alright guys, so I've come to the end of this video. If you like what I had to say, please hit the subscribe button, hit the like button, and leave a comment for me letting me know if you found this video useful. Until I upload my next video, bye.